Welcome to our talk on food and your mood, the link between nutrition and mental health. My name is Megan Ellison. I'm a registered dietitian nutritionist. I have a master's degree in nutrition, and I'm also a certified diabetes care and education specialist. Those are my credentials there. And I'm the owner of Sound Dietitians, which is a local company to the Puget Sound region. We're based out of Snohomish County, but we work with people all over Washington State now that we have telehealth. And our sponsor for tonight is Stilly Valley Health Connections. So you registered through Stilly Valley, and they will be sending you a recording of tonight's presentation. The slides, I've already sent them off to Stilly Valley, and also a bunch of handouts for tonight as well. But it would be good for you to grab a piece of paper, grab a pen, grab a glass of water. We're going to talk about hydration, and get ready to take some notes. You're welcome to put some questions in the Q&A, and I will check on that occasionally and also at the end of our talk tonight. We've got about an hour and a half together, but it's going to be interesting. It's going to go by fast, and I'll give you some pointers of things to be thinking about for your own life. Hopefully this is all going to be practical. We'll have a little bit of statistics, a little bit of, background information, but really I want this to be a practical application type of talk for you so that you can take some nuggets home and start implementing things right away. And it is a two-part series. So you have tonight where you're going to get information, and then next week we'll come back together. We'll check in on how things are going, see what changes maybe you have made, and then I'll give you new information next week as well. I'm going to just check the Q&A really quick. Hopefully you all can see these slides. If you have any issues, please go ahead and give me a shout in the Q&A. Okie dokie. So for class one, we will go over anxiety and depression statistics, some key factors involved in mental health. We'll talk about, are you getting basics, both environmentally, nutritionally. We will speak on some specific nutrients of concern tonight and then do different nutrients of concern next week. Is dietary intervention effective for mood and for mental health? We'll talk about anti-inflammatory intake versus the standard American diet, dive into the gut-brain microbiome connection, talk about fiber, addressing gut disturbances. We will talk about stress impacts on your mental health and on your gut. We might get to practice some belly breathing if we have time, and a touch on mindfulness and intuitive eating strategies. We'll talk more on that next week as well. And then also talk about meal snack timing and macronutrient pairing. Just as a disclaimer, so this is meant to be educational. It's a webinar, so I cannot see you or hear you or know exactly who you are. I'm not your dietitian, although maybe there are some people on here that I actually see as clients. Oh, there is a note here. Can you put just one slide at a time on the screen? We can see two right now. Okay, thank you, Meg. Let me just see here if I can. Yeah, this looks funny to me too. See all slides. Nope. Zoom in. Oh, no. Let me just let me get out of here. Why is this wondering why this is like this? Stop sharing for a second. Yeah, it's weird that it wants to do that. Normally it's just showing one whole. I'm going to end the slideshow. We're going to start over. Mhm. Yeah, a lot of tabs open, so I'm closing a lot of tabs. Okay. Oh, doing it again. Okay. Um, I'm not exactly sure how to get out of this mode. When I go to share, it wants to do this two slides thing. I'll zoom in if there's something to kind of focus in on, and then I also have this option for using a laser, which is kind of nice. So um, we will move on and make the best of it. Um, So, as a disclaimer, this is a webinar. It's meant to be educational. It's not medical advice. Please do check in with your dietitian, or if you have a mental health practitioner, your counselor, your therapist, psychologist, or psychiatrist, and or any of your healthcare providers regarding some of the information tonight. And please don't change anything. Like if you are under the care of a provider, don't all of a sudden go off medication or all of a sudden start taking a bunch of supplements because you learn about things tonight. Check in with that person, just to see that that will be a good fit for you. And, you can always reach out to me. You'll have my information at the end of tonight as well. So we are talking about mental health, and this includes emotional, psychological, social well-being. It really affects everything, how we think, feel, act. It also determines how we handle stress and relate to others and how we're making choices healthy or not. And it really is important for every stage of life, including, childhood all the way through adulthood. And the point is mental health is health. Really, the strategies we're going to be talking about tonight are good for general health, as well as specifically being shown to be helpful for mental health as well. But mental health is health. We're not disconnected, right? Our brains are part of our bodies, and so it's all interconnected. Um, Anxiety disorders are the most common mental illness in the United States, affecting over 40 million U.S. adults. So that would be ages 18 and up, and then about 32% of adolescents 13 to 18 years old. And this is a broad category, including all of these specific things like panic disorders or specific phobias, post-traumatic stress disorder. And then depression is one of our leading causes of disability in the United States and globally. And in 2020, people with at least one major depressive episode, there were about almost 15 million US adults and over 4 million adolescents. So these would be diagnosed depressive episodes, diagnosed cases, right? Whereas I'm just going to go to this slide. This is more reported. So people expressing their, not necessarily a diagnosis, but expressing their own association or, thinking that they have some depression symptoms. And so this is from the behavioral risk factor survey. Um, and you can see here that per age group, the thing I find fascinating about this is the younger age group associates more with depression, 21% here in the 18 to 24 category. And then rates go down as we get older, which is a nice benefit of aging, actually. Let me go back to this slide here. And those data were from 2020, but we do know that since 2020 with the pandemic, we have seen increases in depression prevalence. So this data here is for people age 12 and older. And what I like about this, besides just seeing this increase over time since March of 2020, we do have data to show that things definitely got a little worse mental health wise during the pandemic. But it also delineates females versus males. And we do know that females tend to have more depression than males, or at least associate with depression more than males. And this is data from the CDC just showing the prevalence or rates, again, like self-reported. And you can see that there are different pockets, hotspots, if you will, of depression. Washington's pretty dark. So 24% up to 32% almost in those really dark blue sections. And there's lots of reasons potentially for this because it's a complex situation. One of them being vitamin D, which we're going to talk about. And you can kind of see here, Washington, also upper parts of these more north latitude states. I'm from Minnesota, so upper Minnesota, also Maine. And then some places in the south that may be more related to like socioeconomic situations and social determinants of health. So pretty complex. All right, let me just check on the Q&A. Linda's asking, do I need to register for next week, part 2? If you registered for tonight, you should also automatically get a reminder for next week because this is a 2-part series. That's a great question. Okay. So I'm going to actually read this abstract because I think it really summarizes where we're at. Mental illness, including depression, anxiety, and bipolar disorder, accounts for a significant proportion of global disability and poses a substantial social, economic, and health burden. Treatment is presently dominated by pharmacotherapy, such as antidepressants, and psychotherapy, such as cognitive behavioral therapy. However, such treatments avert less than half of the disease burden, suggesting that additional strategies are needed to prevent and treat mental disorders. There are now consistent mechanistic, observational, and interventional data to suggest that diet quality may be a modifiable risk factor for mental illness. And then it goes on to talk about those risk factors and the modifications. So that's what we're going to talk about tonight. So we know that we could be doing much better, and we have other levers to pull. We have other things to try, and nutrition is one of those things. And then this is a review of reviews. So, lots and lots of data, looking at over 46 different reviews. And basically the conclusion is most reviews in severe mental illness and depression and anxiety reported conclusions supporting the positive effects of dietary intervention. So we do know that dietary intervention really does make a difference. But of course, that's only one piece of the puzzle. There's a lot of key factors happening in mental health, specifically in depression and anxiety, including history of trauma, big T and little t, inflammation and mitochondrial health, which can be impacted by nutrition, environmental exposures, and detox pathways. We're actually going to talk about detox pathways next week. Hormone and neurotransmitter balance, gut-brain axis and the microbiome, dietary patterns and nutrient status, and connection and social support. Of course, this is not exhaustive. Okay. So are you getting the basics? We're going to talk about nutrition and hydration tonight for sure, but these other things really matter as well. So sleep. A lot of times with my patients who come in, wanting to have better diet quality or wanting to lose weight or have better blood sugar control or lower cholesterol, if you're not sleeping well, it is really hard to do any of those other health related things. partly because it changes our behavior. We're tired, we don't exercise, or we're tired and we crave more quote unquote junk food or like ultra processed foods. Um, or it's raising your stress hormones, it's raising cortisol, and you're making poorer choices. If you have something going on with your sleep and it hasn't been addressed, please do get that checked out because that affects the rest of your health, including your mental health. And it's so foundational to everything that it really should not be overlooked. Movement and physical activities of daily living, including exercise, although I know that's kind of, for some people, they don't like the E word, the exercise word, but just movement. Movement in general, we know is associated with better mood. We're going to talk more about that next week. But this is a call to action. If you're not getting steps in, if you're not moving your body in a fun and joyful way, please do try and figure that out in this next week. Like, do one thing. Do, one thing that you haven't done in a while that you want to do. Go to a dance class, take a walk with a friend, put on a YouTube yoga video, something where you're moving your body, you're going to feel better. And, we know that cognitively, but sometimes it's hard to, find the time or make the room for it when we're so busy. But, I've never had a patient say, oh, I wish I would have skipped my exercise. Like that just doesn't happen. Everybody's happy afterwards. Outside time, fresh air, sunshine, having a bigger perspective, literally getting your eyes away from a screen and looking long, right? Like not looking right here, increasing your perspective. Social support, so regular interactions, both to, give and to receive. Very important. Stress management, we'll talk a little bit about stress today and hopefully do that belly breathing. So, some other things that you can be engaging in besides nutrition to really move the lever in how you're feeling overall with mood. Okay, so here's a check-in question for you. So think about yesterday, think about a full day. And the question is, how much fluids did you get yesterday or in a typical day? Add up a typical day for you and include everything that's basically fluid at room temperature. So that does include coffee and tea. There's this myth out there saying coffee and tea is dehydrating. It's not. It is hydrating. There is a slight diuretic effect from caffeine, but it's so negligible that we count the full amount. So if you've got 8 ounces of coffee, count that as 8 ounces. Juice, milk, water, carbonated drinks. Alcohol does not count. Alcohol is dehydrating. So, but anything else that you're drinking on a regular basis, add it up and let's just see what your intake is like. And if you have your piece of paper, go ahead and write that down. Write your number down, how many cups, and you can convert cups. Every cup is about 8 ounces. So you can convert that to ounces if you want. And then let's do some math to figure out how much as an estimate would be a good amount for you. And you can do that a couple different ways. So there is no like one set way to calculate hydration needs. But one way is to go off of your kilograms, and that would be to take your pounds, body weight wise, divide it by 2.2 to get kilograms, and then you can convert that number to ounces. So for example, for a 220-pound person, divided by 2.2, that's 100 kilograms or basically 100 ounces per day. A different way to approach this, if you know your calorie intake, like let's say that you're aiming for 2,000 calories a day, which is kind of an average amount of calorie intake, that would be about 2 liters per day. So you can do like a mil per kcal. So 2,000 kcal diet is about 2 liters or 2,000 mils. This is where that 8 cups come from because a lot of people are on average consuming around 2,000 calories. Now this is baseline. So above and beyond this, if you are exercising or you are sweating, you have a job where you're sweating a lot, um, your needs are going to be higher for sure. And the recommendation is about a half a cup to a cup of fluid for every 15 minutes of exercise. So if you're doing an hour-long class, you're looking at another 2 to 4 cups of fluids to cover you for that exercise. Okay. So compare that to what you wrote down originally. Are you getting enough? Some of our hydration should actually be coming from fruits and vegetables, from the food that we're consuming, or things that are a little bit more hydrating. Like if you have yogurt on a regular basis, that's pretty hydrating, or soup is pretty hydrating. So some of that counts as well. But maybe you need to adjust this. And I will say it's amazing how many of my patients really don't get normal thirst cues. Sometimes they're actually confusing thirst and hunger. A lot of times we'll go for carbohydrates when we're actually just underhydrated. We're kind of looking for that for water, but chips taste better. So sometimes we'll go for gravitate to the carbohydrates instead of just like hydrating, right? So, check in with that. And if you are not getting thirst cues, you might need to just set up like external alarms, reminders to get in, so many cups at certain times or intervals throughout the day. Some of my patients actually now have gotten those, they're like timers, but it's a water bottle that has times on them that cues them over the day so that by the end of the day, they're basically getting all their hydration needs met. Whatever works for you. But if you're not getting the internal cues, you might need an external cue as a reminder, right? So think about that. Okay, let's talk about some specific nutrients of concern. So tonight we're going to talk about iron, B vitamins, vitamin D, and omega 3s. And iron is a tricky one because a lot of times I'm finding when I actually ask for a ferritin panel or ask for an iron check, sometimes the docs, sometimes the physicians are a little hesitant to add another lab um, because they're looking at like a CBC, like a complete blood count. And if they're not seeing acute anemia, they're like, oh, the iron's fine. But actually, I'm finding low iron all the time in my patients, especially in my older population, people who have some digestion concerns, um, women who are still menstruating, definitely a problem because of iron losses. And if depressed mood or problems with attention, lethargy or fatigue, or restless leg syndrome actually is associated with low iron. If you're having those symptoms, it's worth getting it checked. It's an easy test. You can just add it on to your blood work next time you go in. Either a ferritin panel, or that's my preference, is to get a full panel to see what's going on there, or just an iron. And get it checked because a lot of times I'm catching this when, the red blood cells look normal, but it is impacting things like, of course, energy, mood, but then long term things like bone health, for example, bone density and muscle health. So we don't want to miss it. Other things to be thinking about: B vitamins. We aren't often checking B vitamins other than B12. And oftentimes I will say, like, get a B12. If you're getting extra labs done, go ahead and get a B12 if you are super tired, especially if you have been consuming less animal proteins. And we'll talk about some specifics in this. Or if you have had any substance use disorder. So some of these low levels of B vitamins are associated with too much alcohol and not enough of your healthy foods coming in. Of course, vitamin D in the Northwest is a problem. We'll talk about that. And then omega-3 intake is also associated positively with reduced depression, and most of us are not getting the recommended amounts of omega-3s. So let's talk about iron first. So we've got two main sources of iron. We have heme, which is from animal sources, and non-heme, which is from your plant sources. Your heme sources or your animal sources are easier to absorb because with the plants, there are some other things in the plants. They're called anti-nutrients that can kind of compete either for absorption or bind some of these minerals that make absorption a little bit harder. But don't worry about that because there's so many other positives to eating more plants. It's just that you have to eat more of them to get the same amount of iron as you would from, beef or lamb or pork, for example. And I put these kind of in order with the animals. So beef, lamb, pork, and then chicken and turkey, and then fish and seafood, and then eggs, as far as how much iron are in these sources. And don't forget about your cast iron skillet. So if you are cooking in a cast iron skillet, some of that, those iron ions will actually leach into your food. So if you're low in iron, this can be one more way to get iron in your intake. And it's actually recommended for people who have like iron overload or hemochromatosis to not use cast iron skillets for that reason. Um, Season it well so you don't have to do a bunch of scrubbing. And then it's basically like a non-stick skillet, which is great. Here are some with the plants. Here's some sources. Your dark leafy greens for sure. Molasses is one of my favorite, like a couple tablespoons of molasses in warm milk or like a warm soy milk, blended up kind of like a almost like a latte in the, well, right now in the fall and the winter is brilliant. Lovely addition. Beans and lentils, nuts such as almonds and pistachios, some of your fruits like figs, raisins, and plums, or prunes, dried plums, are better sources than other fruits. Our enriched cereals, where we've actually added iron, so total and grape nuts are good examples of that. Soy products, so anything that is made from soy, like tofu, tempeh, soy milk, edamame, and then whole grains or enriched grains. And we'll talk about what that means in just a second. But with any of these iron sources, you will get better absorption if you have some vitamin C along with that iron. So for example, like let's say you have beef fajitas where you've got beef and peppers there. The peppers are high vitamin C. So that's a great combo. Or let's say you make a lentil salad and you add some, broccoli to it, or maybe you make it more like fruit based. You add some oranges or mandarin slices. That would be delicious and help absorb some of that iron. So you can kind of, do that pairing for a little bit better absorption. All right, let's talk about your B vitamins. So B12 is one that I see deficient often, quite often, and it affects, how you're feeling energy-wise. It affects mood. There's actually a lot of things that B12 does in the body, but those right off the bat, like a lot of times people know like something isn't quite right. And unfortunately, B12 is only naturally occurring in our animal sources. So if you're trying to do more plants and you're doing a little bit less meats because of like heart health or environmental health or even mental health, right? You might be getting a little bit less B12. So do think about some other sources. If you are a vegetarian, but you're still eating eggs and dairy, you will get some B12 that way. And then we do have fortification, like in nutritional yeast, which has anybody used nutritional yeast here? Go ahead and put something in the chat if you have and what you like it on. And then our milk alternatives like soy milk, for example, a lot of the milks are fortified, and you do want to be looking for that fortification. Fortified is basically when we've added vitamins or minerals into a product that doesn't naturally have it. It's fortified, while enrichment is really where we have removed some of the nutrition and then we're putting it back in, like in our grains, for example. The nice thing with B12 is we can store it. So even though it is a water-soluble vitamin, just like your other vitamins, it does get stored in the liver. And so deficiency happens over time. Now, it doesn't take decades. It really could be depleted within a couple years if you go to like a vegan lifestyle, for example. And we do see that the populations with the highest B vitamin, B12 specifically deficiency, those people with vegetarian or vegan intakes, infants breastfeeding from vegetarian or vegan moms, older adults, and that has to do with the fact that stomach acid is oftentimes lower in older adults. And anytime that we are reducing stomach acid, so a lot of my patients come in on these antacids or PPIs or H2 blockers where it's, limiting stomach acid, which then limits that intrinsic factor, which is the thing that we really need to absorb the B12. So if you have been on something that reduces acid for a while, it's highly likely that you could have a B12 deficiency. And then also metformin. So we know metformin is associated with B12 deficiency. And so the recommendation is if you've been on it for 5 years or more, that you do get your B12 checked regularly. And then we'll know how to supplement if it's low. Or change your diet, right? Our other B vitamins like thiamine, riboflavin, niacin, pantothenic acid, fibroxidine, biotin, and folate are found in many, many foods. So it's less likely that we have deficiency here, but where we do see deficiency is when there's this combination of poor intake and oftentimes substance use, especially like alcohol. And sometimes those go together, right? Like if people are consuming excess alcohol, they're getting their calories that way, a lot of times then nutrient intake from foods will be decreased. Plus, the substance causes more losses, specifically of thiamine, and more utilization of those B vitamins as well. So it's kind of the perfect storm for having a B deficiency if you've got a lot of alcohol coming in and that's replacing dietary intake. But it's, found in all kinds of things: meat, fish, poultry, eggs, and dairy, leafy greens, legumes, whole grain cereals just naturally, and then our enriched refined cereals. So in the United States, we do have a mandate that enriched refined cereals, where we've stripped off some of that nutrition, that we are adding back some of the nutrition. Of course, it's not all of the nutrition. It's only certain nutrients. From the B vitamins, it's niacin, thiamine, riboflavin, folic acid, and I will also mention iron is one of the enriched minerals that we add back in. And so we are not seeing, for example, neural tube defects that we would from folate deficiency, partly because we are enriching our refined grains. And a lot of people are eating much more ultra-processed foods these days. So we're very fortunate in this country that we do have this fortification and enrichment regulation. Okay, what else? Oh, these B vitamins aren't really stored other than B12. And so, we have to eat them on a regular basis because we don't just store them up in the body. Okay, and I don't see any chats about nutritional yeast. So let me just tell you how you can use it. A lot of people like it sprinkled on popcorn. It's got kind of like a cheesy, salty, a little bit umami flavor, a little savory flavor, or on mashed potatoes, or sprinkled on vegetables. You can put it in soup. You can put it all kinds of places. So if you do have issues with B12, that is something that you could add to your diet to get a little extra and get some flavor. Okay. All right, let's talk about whole grains. So when we are doing our processing of grains, we're removing quite a bit of the nutrition. So with a whole grain, you have three main parts: the bran, which is that outer part that has the fiber, especially the insoluble fiber. And that's also where a lot of the B vitamins are found and some minerals. And then we've got the endosperm, which is basically the carbohydrate or the starch portion of the grain. So it gives us the energy, some protein, about 25% protein in there, and then some B vitamins as well. And then the germ is that little nugget there that has even more B vitamins, but then also your fat soluble vitamins. So this is the little germ where the fat is. So they remove that so it doesn't go rancid in order to basically make these grains shelf stable for longer. That's part of the whole purpose of it. But in the process, you're removing some of those fat soluble vitamins like vitamin E, vitamin K, minerals, antioxidants, like vitamin A, healthy fats. So you're basically stripping off a lot of this nutrition when we have refined grains, which is what a lot of our processed foods are made out of these days. So some ideas for incorporating more whole grains into your diet, and the recommendation is at least half of your grains be whole. So probably the most common one off this list is oatmeal, and it's a great time of year to be incorporating more oatmeal. Either overnight oats where you let it soak, or crock pot oatmeal overnight is lovely as well. Or you make a big batch of like steel cut oats on a weekend and then have it left over for the week. Quinoa is great because it cooks in 15 minutes and it's high fiber and higher protein, a little bit lower carb compared to some of your other grains. It's technically a seed, but we treat it like a grain. And then there's so many kinds of rice: red rice, brown rice, black rice, wild rice. If you are a white rice person or you're trying to get the family switched over from white to brown, this sweet brown rice is a nice option. It is a little bit lighter in color, so it looks more like refined rice, like white rice, and it's a little shorter, so it's more sticky. It has more amylopectin in it, so it acts more like a sticky rice. And you can find that at all the grocery stores these days. So look for the sweet brown rice if you're not quite ready for the full-blown nutty, dark colored textural rice. The sweet brown's a nice way to ease into it. Other options: millet, teff, barley, rye, bulgur. Bulgur's nice because it also cooks in 15 minutes. It's basically cracked wheat. And if you've ever had like tabbouleh, that's what bulgur is, or that's what it's typically made out of, is bulgur. All right, so maybe think about some more whole grains or swapping out some of your grain options to be more whole for the coming week. There's a question in the chat saying, is there a big difference between taking sublingual B12 versus caplets? So yeah, I mean, it digests and absorbs a little bit differently. Know that like with your supplements, the amounts can vary dramatically, right? With B12 though, it's interesting. Your absorption rate goes down as the amount increases. So from a from an oral route, either sublingual or from a capsule or a pill, usually we don't see toxicity with it, just because your body will down regulate absorption once you have enough. However, I will say We do sometimes see B12 overload, especially with like intramuscular injections. It's possible to get too much. Or nowadays with these energy drinks and kiddos especially, um, we have seen some B12 toxicity with that as well, because sometimes it's thousands and thousands of percent, and they're drinking, multiple of these energy drinks per day, which actually I'll probably put a slide in for next week on that because there is an association with energy drinks and increased suicide rate, especially for adolescents. So yeah, do be careful with those, but talk to your doctor or your dietitian about dosing, so amounts, if you need it, or just food ideas, right? And ideas for making your digestion and absorption better from your food. And then you can talk about, yeah, different routes to take or different methods. Okay. Hopefully you all got some sunshine this summer because we're basically at the point where we're not converting it anymore here in the Pacific Northwest. Um, the recommendation for the summer months is 10 to 15 or 10 to 25 minutes, 2 to 3 times per week. So like arms, legs, face or chest. However, from about October through March, we really don't have the right angle and intensity of sunlight here. So the prescription is to go to Hawaii in January or February. But if you can't do that, you could also go to Southern California. Or maybe you're getting it in your food. Maybe you're eating a lot of salmon and tuna and sardines and egg yolks. We do have a little bit of vitamin D fortified in our milk and our milk alternatives. And actually, that was a very, very successful campaign that was started to combat rickets, a long time ago. And it worked, with kiddos really needing that vitamin D for bone health. Adding the vitamin D to milk was helpful because then they were getting that on a regular basis as part of their diets. However, we have had a rickets resurgence in kiddos because of them not eating or drinking as much milk lately. So yeah, it can be a problem. And vitamin D does so much more than just, bone health and, bone density. It's also involved in immunity. It's involved in blood sugar control, definitely mood, muscle health, so many aspects of the body that it impacts. And it is a hormone. So it goes other places, it's a little molecule that travels throughout the body and does different things on different organs. So it's very, very impactful to our overall health. And if you haven't had your vitamin D checked in the Pacific Northwest, most people, meaning over 50%, so the majority of people here are deficient. And it's helpful to get it checked because then we can actually run a calculation to say, okay, how much do you actually need to supplement in order to get your levels up quickly? Within 3 months, ideally, we'd get those levels up pretty fast. This is an example of my vitamin D. So from a while ago, this was after supplementing. So you can see that the normal, quote unquote, normal range here per this lab, and you'll notice it varies based on the lab. So the normal range for this lab is 30 to 100, and I'm at the very, very bottom, and I will tell you I did not feel very good at this. And this was after supplementing for quite a while. So, get it checked so that and also just know that normal range is not necessarily optimal range. So this would be a time you would talk with your dietitian or your provider. Hopefully they can give you some guidance as far as like what would be more optimal. For vitamin D, really above 40 is my goal for all of my patients. Somewhere above 40. We don't want it too high, but definitely above 40. And it is a fat soluble vitamin, I should say that. So when you are eating foods or if you're taking it, like let's say you've got a supplement and you're taking your vitamin D first thing in the morning with water, you're not absorbing that as well as you could, because it is a fat-soluble vitamin. You really need fat or food to help absorb that vitamin. So have it with some fat. Um, there's this great sunshine calendar on grassrootshealth.net. And you can kind of see here at our latitude, we're up here at the 47th degree. We're not making any in January, February. We're making some March through May, and then we've got some really good sunshine months, June, July, August. September, October is pretty much the end of synthesizing D here in the Seattle area. And then November and December, we really can't make it. So you can check that calendar for where you're at in the world. If you're in the United States, another way to look at this is anything above the 37th parallel, and you're going to have struggles with synthesis at least at some point in the calendar year. Okay. So that's vitamin D. Get it checked, and then we'll know how to supplement. If anybody has had their D checked and want to share that, go ahead and do that. Or if you have any questions, you can put that in the Q&A. Let's talk about omega-3 fatty acids. So low levels of this PUFA, this polyunsaturated fatty acid in the blood is linked to depression. And we know that it's also ameliorated. Depression has been shown to reduce with greater intake of omega-3 fatty acids. So we have a lot of research on this at this point. And it is considered essential in the sense that we cannot make it internally. We have to eat the omega-3s. The best sources, fish and seafood, because it is preformed. It's that EPA and DHA, the eicosapentaenoic acid, docosahexaenoic acid, the long chain fatty acids that the fish and seafood put together for us. It's preformed. So when we take it in, we're really getting the EPA and DHA, where most of this research is showing benefit. Now, if you are a vegetarian or a vegan, you can also get the plant-based form, the ALA. It's a little bit of a shorter omega-3, but it is still essential. Like, we don't make it, so we got to eat it. And you can find that in walnuts, chia, flax. Make sure the flax is ground so you have access to that omega-3. And canola oil actually has the best ratio of omega-3 to omega-6. It's a 2-to-1 omega-6 to omega-3 ratio compared to all of our other oils. So that's a nice option, like a clean cooking oil, very neutral flavor, has a little bit higher smoke point than olive oil. So for sauteing or baking, that can be nice. And then you're getting some omega-3s there. I will send you a handout on omega-3 and brain health and sources of omega-3s. Most people are not getting enough. Okay, let's do a little check-in. So we'll check in on these nutrients. So have you gotten your vitamin D levels checked, especially if you're living in the Northwest? Have you ever asked for a ferritin panel with your labs, especially if you are a menstruating woman, or if you have something going on with your digestion and absorption, and if you're just tired all the time? Same thing with vitamin B12. If you're vegetarian, you've got lethargy, you're on a PPI, so acid suppression, or you're older, those would be reasons to get it checked. Elizabeth from the chat says D was 72 in June. Wow, good for you. That's great. You probably don't need to be supplementing. If that was at the end of basically winter for us, going into the summer where we really make it, but maybe you're already on a supplement. That's possible. Okay, have you eaten leafy greens today? What about incorporating whole grains into your day? Have you had 2 to 3 servings of fish or seafood this past week? That is The minimum recommendation from the American Heart Association is 2. 3 would be better. And then ask your doc or your dietitian for recommendations on supplementation if needed. We can certainly talk about food from a dietitian perspective and digestion, which impacts, nutrient utilization. But then also we're happy to talk about supplements, and some people just really need that. I definitely need a supplement for actually all 3 of those things we talked about tonight, the D, the iron, and the B12. All of mine were low last time I had them checked. So, and I eat a pretty varied diet. But I live in the Northwest and I don't eat a whole lot of animal products. And I am still menstruating as a middle-aged female. So I'm losing a lot of iron that way. And I definitely was feeling it. So get it checked. And then I will send you a supplement safety handout to think about what to look for if you're, buying a vitamin D, for example, or you're getting a B12. Ideally, you would have third-party testing on that. So it would be tested by a third party so you really know what you're getting in that supplement and you're not wasting your money, but also that it's not contaminated and it has the right dose, or it has the dose that it says it has. One of the most common third-party testers out there is USP. You'll see their little USP symbol on the outside of the batches that they've actually tested. Another one is NSF or UL. But I'll send you that handout to just be looking for those icons, looking for those little labels. Sometimes they'll say tested in our laboratory, but that's like by the manufacturer, not necessarily by a third party. So, be a little questioning of supplements because they're not regulated the same as prescription medications. So it is, it is a little bit more of a question mark as to what's actually in that. And with all of these things, remember when you get your labs back and someone said, oh, it's normal range, normal does not necessarily mean optimal. So check your range for optimal levels. For example, B12, under 500, I am thinking, what is going on with you? You're tapping into your stores, even though it's still technically in the normal range. It tells me something's going on. Either you're not taking it in, you're not absorbing it well. So yeah, a lot of these will possibly look normal, but when you dig a little deeper, it could be actually indicating you're not optimal. Okay. There's a question in the chat about, oh yeah, Elizabeth, with your 72 of vitamin D, you're on a supplement. So I would ask your doc or your dietitian if you need to back off on that, because if you were at 72 and then you went into the summer, probably you need a little bit less. But now we're back at the winter time, so you might, get back on that supplement for the winter. But I don't, I wouldn't want you too much above 80. So yeah, talk with your provider about that. And then there's a question, can a multivitamin cover all these supplements? It depends. So some multivitamin, multi-mineral supplements will have vitamins and minerals. Some just have vitamins. Some have vitamins and some minerals, but not iron. It really depends on what it is. And sometimes you actually don't want to be mixing these necessarily. So for example, let's say you're actually iron deficient. Well, I would want you to put that iron away from other things that could compete for absorption. So I'd want you to just take an iron supplement with a high dose vitamin C food, like an orange, or peppers or broccoli, because the other minerals in a multi can compete for absorption with that iron. So for example, we really try to avoid iron and calcium going together because the calcium will basically get absorbed and then sometimes you're not absorbing the iron as well. So, a multi is good in the sense of, it's cheap, it's kind of easy insurance for covering your bases. And the research that we have, the observational trials looking at the association with people on a multi do show that people on multivitamins tend to be healthier. Of course, they're also more conscious people and they're making other healthful changes and choices. But the latest research is showing an association or a correlation with also better cognitive health long term. So I feel like it's a cheap, easy kind of insurance policy. So that's great for a lot of people. But if you have a specific deficiency, like vitamin D or iron or B12, those things are going to be needing to be addressed with extra specific supplementation. And that's why we get it checked so then we can give you an actual dose of those things. And usually you take it away from your other supplements. And then there's a question, if I am a vegetarian, should I speak with my PCP about omega supplements? You certainly can. Yep, that would be a good option. I think that's, yeah, great idea for you. And then enjoy the walnuts and the flax and the chia every day if you can. All right, so those are some checks on things. Let's keep moving here. Okay, so this is a systematic review of randomized control trials. So really like the best of the best, including over 49,000 participants. And all these studies found positive outcomes for depression with dietary patterns that promote increased produce, whole grains, low-fat dairy, lean protein sources, while at the same time decreasing processed and high-fat foods. So what we are taking in really does make a difference. And this is our sad state of affairs, our standard American diet. We tend to be taking in a lot of fried foods, so added calories, but also added, molecules from the high temperature heating, which we know now are not great for our health and are associated with inflammation. Soda with that extra sugar and calories, refined carbs, so basically a lot of that nutrition stripped off, especially the fiber. Lard, which is a saturated fat, processed meats, which a lot of times, our quality of meats isn't the best if we're eating fast food, for example, or highly processed meats that have a lot of the fat in there, the saturated fat, including additional, preservatives, nitrates, nitrites, extra sodium, etc. So we've got, basically an inflammatory diet. And unfortunately, besides the excessive intake, so excessive refined carbs, added sugar, saturated fat, sodium, and calories, we do know that there is this dichotomy of at the same time as having too much from a caloric density sense, we have too little from a nutrient density sense. And so it really is a form of malnutrition. And we're finding this in people with obesity where they're actually malnourished in certain ways. So, for example, the average percentage of people not meeting recommended intakes for these nutrients in the United States, 97% of people are not meeting potassium recommended intakes, 94% vitamin D, almost 2% choline, and the list goes on and on and on. So we have a very high calorie diet, but we don't have a very high micronutrient diet, meaning vitamins and minerals and, of course, fiber that goes along with that. Okay. And that leads into this whole inflammatory process that is underlying our chronic disease situation. Partly it's from inflammatory foods and a lack of anti-inflammatory foods. Inflammatory diseases, for example, diabetes, intestinal bowel disease or inflammatory bowel disease, autoimmune conditions, obesity. We know now that diabetes and obesity are pro-inflammatory conditions. Not only does inflammation contribute to them, but then those conditions contribute to inflammation. So it's this vicious cycle with it. Environmental factors and food sensitivities, Toxins, air pollution. Here in the Northwest, we deal with smoke almost every summer. Chronic stress can cause inflammation, especially in the gut diseases, gut dysbiosis, which we'll talk about in more detail. So what's the answer nutritionally? Well, the best research that we have is on the Mediterranean dietary pattern. And that is a dietary pattern that includes a lot of whole foods. So whole grains, fruits, beans and nuts and vegetables, healthy oils, olive oil in particular. And partly that has to do with the fact that the olive oil is unsaturated, but also in olive oil, there are special polyphenols, that greenish color that we know now are feeding the gut microbiome. So even more anti-inflammatory components coming out of that because of feeding the good gut bugs. Dairy, fish and seafood, poultry, eggs, and then sweets and meats are at the very tippy top here. I like this pyramid because it also has a base of daily physical activity. So in most Mediterranean countries, they're also walking and they're being social and they're gardening and they're going, down the street to see their friend. And it's, the movement is built into their lives. So there is that aspect of movement and social engagement as well. Okay, so let's just pause at this slide really quick. It's very colorful. Think about your own dietary intake and what you had today, for example, and how that kind of fits into this pattern. So there's a lot of mostly whole food, although some refined, like pasta, for example, or breads. But again, a lot of these are made from whole grains. So even though there is some processing, it's minimal compared to a lot of our ultra processed foods that we have these days. And we're pretty inundated with ultra processed food options that both, remove the nutrients, but also just like lack of nutrition, but it's also adding a lot of those extra things we don't want, like the extra salt, for example. But think about your day and how this kind of fits into the Mediterranean pattern. The other dietary patterns that we have a lot of good research on with managing chronic conditions and lowering inflammation would be the DASH diet, which is the dietary approaches to stop hypertension. It's basically like this pyramid, except the fruits and vegetables are on the bottom and the grains are just one rung up. So if you just flipped those. And then the MIND diet, which is specifically looking at brain health outcomes. And the MIND diet is basically a combination of Mediterranean and DASH together. So any of those patterns would give you a lot of good whole foods, a lot of phytonutrients, fiber, a lot of color there, as well as, plenty of proteins and just nutrients in general. Okay. So let's talk more about gut health. So the role of your gut microbiota, or basically all your different like gut bugs in dietary interventions for depression and anxiety, it's really a big deal. So our gut health is really impacting our overall health. And that has to do with several factors, some of which this diagram does a nice job of showing the patterns of things and how they're interacting. So for example, fiber is affecting your gut microbiome with motility, but also feeding your good gut bugs. On a negative side, like some food additives or like substances like alcohol, for example, could be negatively impacting your gut microbes. Prebiotics and phytochemicals. We'll talk more about prebiotics next week, but they're basically substances that your bacteria especially feed on. So like asparagus, for example, And I already mentioned the term phytochemical or phytonutrient, which is basically just plant-based substances. Some of those colors and those polyphenols, like the green and the olive oil, that we know now actually feed our good gut bugs. Even things like macronutrient ratios, like we see with really high fat, really high protein diets, like some of these, kind of fad diets where it's not very balanced, we do see changes in the microbiota as a result of that, and more bad guys typically, and less of the good guys. So we do want variety in our intake, and especially the high fiber foods, which are carbohydrate foods. And so I know carbs have gotten kind of demonized, partly for a good reason, in the sense of like ultra processed, like super refined carbohydrates. But we don't want to just cut out all of our whole foods and our whole plants that have carbohydrates, because that's where you're getting a lot of your fiber from. Alrighty. The gut microbiome or microbiota is then affecting things like inflammatory processes. So either anti-inflammation, they make short chain fatty acids, the good guys do, based off of, being fed well. So they make these anti-inflammatory processes that then get absorbed. It actually feeds your gut enterocytes, like the lining of your gut, to keep your gut really nice and healthy. And then also goes throughout the body for lots of, lots of things that they do. But one of the things is just anti-inflammation. Um, and we can, this is it's all circular. We can make food choices that then affect our gut bugs, and our gut bugs actually affect our food choices, affect how we feel, and affect what we want to be eating. So, start somewhere. Start somewhere. Maybe it's the Mediterranean diet. Maybe it's just more plants in your life. Maybe it's just less of the sugar and the refined foods, finding a nice swap, but it does make a difference from a mood and mental health sense. Okay, with the microbiome, low fiber is a key driver of depletion and leading to chronic disease. We know that, and most Americans are getting less than half of the recommended fiber intake. Also, low fiber diet is associated with lots of species in the gut, and those reduction in those end products of fermentation, like the short chain fatty acids I was just mentioning. Here's a couple in this little diagram here, like propionate, acetate, and butyrate. And we do know that a Western diet has disrupted our whole gut microbiota. So that SAD diet, the standard American diet, which is low in the color, low in the fiber, is a negative impact on our gut health. It's very well established at this point. Serotonin and dopamine, technically the only two things you enjoy. That's just a little joke there. But it is interesting to think about how our gut bacteria are impacting us with their creation of neurotransmitters. And here are just some specific strains that go along, or species technically, that go along with these neurotransmitters. So GABA is made by lactobacillus and bifidobacterium. Let's skip down to serotonin is produced by Candida, Streptococcus, and Escherichia. Dopamine, Bacillus, and Serratia. So, the variety of gut bugs and what we're feeding them makes a difference for neurotransmitter production. And we know now that about 95% of our serotonin is actually made in the gut. So this has changed over the course of my career. This was originally like 75% when I was in school, and then we realized it was 80, and then 85, and then 90, and now the estimate is 95% of serotonin is actually made in our gut, assuming you have a healthy gut and you're feeding it well. And about half of dopamine. So this 45% now really should be closer to 50% based on the research I'm seeing lately. And the gut-brain interaction is very, very strong. So we know that we call it like a bidirectional highway of communication, where the gut is communicating to the brain is communicating to the gut, and they impact each other. So, you know, and you probably have experienced this from, your own life. Like if your gut is upset, you are not doing well, probably brain wise, right? Or if you're super stressed, we can see that impacting gut. Like if you have stress induced diarrhea, or sometimes my patients will actually get the opposite, those stress induced constipation, where it really changes motility and they're clenching up and like nothing's going through. So motility is impacted because of the hormones that are being released from the brain. Um, we even know that your how you go into the meal, like are you stressed and busy and not focused on the food versus are you going in mindfully and more in a parasympathetic side of your nervous system. So if you're in fight or flight, you know, nutrient absorption is harder because that blood is being shunted away from your digestive tract to go to your brain and your extremities so you can run away from the tiger or whatever, the stressor is. Whereas when you go into that meal with in what we call the rest and digest mode of your nervous system, so that parasympathetic side, it actually helps coordinate your digestion better. So release of stomach acid and even like the sphincters opening and closing and motility is impacted. So, even just how we're going into a meal makes a difference on how we're digesting and absorbing that meal. So we really want to be good to our microbiota, and this brain health really does start with digestion, because you basically are what you can not just eat, but what you can also digest and absorb, and also eating your microbes and what they make for you. So it's all interconnected. Okay, let's look at healing the gut. Oh, I do have some notes there. That's interesting. So, couple topics, like couple big things right off the bat. If you're trying to heal the gut, we do know that substances like alcohol and smoking cessation really are important for healing the gut. We do want some probiotics, so live active cultures, like from fermented foods or possibly from supplements. And we'll talk more about that in detail next week, like which strains, not just the species, but which strains of probiotics have some research associated with mood and mental health. Prebiotics, which is basically fiber and phytonutrients of plants. And then more living in the parasympathetic side of your nervous system, ideally. And we do know that intestinal permeability is related to depression and anxiety, because leaky gut, so intestinal permeability is AKA also known as leaky gut, which is now very established in the research. 10 years ago, it was like, is this a real thing? And now we know, yes, it absolutely is. We can measure it. Leaky gut equals leaky brain, meaning there is neuroinflammation. So in the brain and nervous system, when you have leaky gut. So if you've got gut disturbances, we really want to address the gut in order to have less of that inflammation in the brain. It does take some time for this to not just heal. Like, for example, my patients with celiac disease, where, that the basically like the villi in the gut, those finger-like projections, have been blunted. Sometimes that takes a year to regrow it after cutting out gluten, for those people who actually have an autoimmune condition that's damaging their gut lining. So sometimes it takes, a long time to heal. As far as your gut bugs, like you can start adding fiber and phytonutrients and change those gut bugs pretty quickly. However, you don't want to, ramp up your fiber so fast that you have gut distress. And we'll talk about that next. There is a chat. Does menopause affect gut health and what can we do about it? Yeah, absolutely. So we do know that your hormones, including estrogen, affect your overall gut health. And in menopause, we do tend to start losing species. We have less diversity in our gut microbiome. And so, what can we do about it? Well, we can address our stress because that's a big one in menopause. You can talk to your provider about hormone replacement therapy if that is appropriate for you. Have the conversation. If you have any sort of gut like GI issue, and we're going to talk about what some of those are in a minute, we do want to address that because that actually can be impacting your hormones. And some of my patients with like SIBO, small intestine bacterial overgrowth, or IBS that hasn't been addressed actually have worse symptoms, worse menopausal symptoms. And once we address the gut stuff, actually the other stuff gets easier to manage or goes away because of the estrobolome. So basically, like how your estrogen and your hormones are being impacted with gut health. So there's a direct correlation there. Yeah. And then the things we're talking about tonight, some more plants, more fiber. Let's look at the next slide here. So the deal with fiber, it's only found in plants, not in animal products. And you do want to ramp it up over time slowly so that you're avoiding GI distress. And, it's impacting your gut microbiota. So they need time to adjust too, right? You're basically selecting the guys and gals. They don't really have a sex, I don't think, but you're selecting the microbiota, based on the color and the fiber that you're feeding them. Just like we have different preferences, your different strains have different preferences. So you want a variety of intake of your plants, different colors, different fibers, so that you are having as much chance of a robust, varied microbiota, meaning, all these different species and strains. But they do take time, to adjust. And so if you're all of a sudden changing your diet overnight, you might have some GI distress. That is possible. Or if you already have GI distress, like you tend towards diarrhea or constipation, you do want to make adjustments, slowly over time. Ideally with a provider who really knows what they're talking about, GI wise, because so it's very complex, and so often my patients with GI conditions come in and they've just been miserable and trying to figure it out on their own, and it's just not really working. So get some help with that. The recommendation is 2 to 4 grams of fiber to increase per week until you get up to your goal. And I will send you a fiber handout, or Stilly Valley will send that fiber handout over to you. And this is based on calorie intake. So another way to think about this is at least 14 grams of fiber per 1,000 calories. So typically the recommendation for guys is higher than for gals because of calorie differences. But you can also, aim for more than this. This is just the recommended intake for general health. But you could increase this and potentially have even more benefits. And try to focus on whole foods rather than supplements, because with the whole food, you're getting that synergistic effect of not just the fiber, but the phytonutrients and the vitamins and the minerals that it's packed with, as well as, some of the fluids too, like in your fruits and vegetables. So we do see, more benefits when it is from food than from supplements. Not that supplements are necessarily bad, and sometimes for my patient population dealing with GI issues, we definitely use supplements occasionally, specifically like psyllium for added soluble fiber. But if we can do it with real food like ground flax and chia, and then you're also getting the omega-3 benefits, it's a win-win. It's a really nice way to go. Okay. And I do want to just mention the 6 conditions commonly misdiagnosed as IBS, just because IBS affects so many people, about 15% of the population, possibly more, because a lot of people don't report their GI symptoms. Um, and IBS can look like other things, or other things can look like IBS. For example, small intestine bacterial overgrowth, bile acid malabsorption is also a common one. Histamine mediated reactions, especially if you have other environmental allergies going on. Congenital sucrase isomaltase deficiency. Usually this is the people who have had like chronic diarrhea since childhood. Pelvic floor dysfunction or outlet dysfunction, systemic nickel allergy syndrome. And in my patient population, I have found all of these things where patients come in diagnosed with IBS and it's really something else going on. So don't just suffer, even if it is quote unquote just IBS. Please don't just suffer. Get specialized help, because there are so many things that we can do for these conditions and for IBS. So you're not just having chronic GI distress, because it really is impacting not only your quality of life, but your nutrient absorption, right? Okay, that's my little plug to see a dietitian specialized in gut health. Okay. We do know that stress management, so this kind of goes back to, not just the food side of things, but some of that environmental and like lifestyle side of things. Stress management is really important for your overall gut health. So it's affecting gut motility. It affects changes in the microbiome when you have that chronic stress. We know that now that the stress hormones can actually cause damage to the gut lining when you've got this chronic, high stress happening, which leads to altering digestion, altered nutrient absorption, induces inflammation. And we do know now that, there's this inflammatory thing that happens when your gut microbiome is off, and that is, going directly to depression and anxiety, because it's going directly to your brain, right? So do think about your stress management. How do you lower your stress? You can't really lower necessarily what's coming at you unless you, get out of a high stress job or a high stress situation. But how you manage it can really make a huge difference. So let's talk a little bit about diaphragmatic breathing, which is one way that you can get out of that fight or flight side of your nervous system and into the rest and digest side of your nervous system. And we do see that even just a couple minutes of diaphragmatic breathing, or what we call belly breathing, can shift us from from fight or flight into rest and digest. So let's just check on the time. We're almost out of time, and we've got a lot of slides to go. So I'm not going to go through this with you, but just know that you can type this in to the internet and find, lots of examples of diaphragmatic breathing. Basically, you want to be breathing into your belly, not so much your chest. You're getting into that pelvic floor, in the bottom of your abdomen, and the in breath is about half of whatever the out breath, or the out breath is double whatever the in breath. So if you do a 4-count in breath, try and slow down that out breath to like an 8-count. Okay, let's keep moving on. So along with that, like slowing down, deep breathing, especially before the meal, to get into that rest and digest mode, to digest your food better, that's also going to help with practicing mindful eating. So slowing down ahead of time, focusing on the food, savoring the food, tasting it. Sometimes we eat so fast we don't even taste it. Ideally, we'd be away from distractions if possible. Like, don't do what this lady here is doing where she's working and she's got her calendar and she's on the phone and she's trying to eat a slice of pizza at the same time. Slow down, be mindful, possibly get away from your desk, go outside even if you can. Focus on the food. Sometimes it's nice to light the candles and get out the linens. Just if you're super busy, being intentional to slow down can be really helpful. And then checking in throughout the meal, rate your fullness, aim for that 80% full. Try to not get past that mark because oftentimes we're not really sensing it quite quickly enough, especially if we're eating fast. And then it takes that good 20 minutes to have the stretch receptors and the chemoreceptors and the thermoreceptors in our stomach telling our brain that we're actually full. And don't be scared of hunger. So a lot of my patients who come in, especially those who have been chronic dieters or are trying to lose weight, they're so scared of being hungry, but that is a normal part of biology. And oftentimes we are suppressing hunger artificially with drugs, frankly, caffeine, nicotine, and or stress. So, skipping breakfast is pretty common, and using caffeine and stress to get through the morning, possibly skipping lunch, and then getting hangry by the afternoon where you're having a low blood sugar and then eating or basically really overeating from the afternoon until we go to bed. That is a classic pattern that I see all the time, and it really is impacting mood. Not only is it impacting like irritability and mood and how you're feeling, but it's impacting your opportunities for nutrition, right? If you just have like one main meal at the end of the day, how much fruits and vegetables can you really fit into that? You just don't have as many opportunities for a lot of those things that we looked at on the Mediterranean diet, the nuts, the seeds, the fruits, the vegetables, the whole grains, if you're only eating one meal a day. And I will say that the majority of my patient population who come in with newly diagnosed diabetes are the people who skip breakfast and sometimes lunch, and they're eating most of their calories in those evening hours. So one thing that we want to do is have space intake over the day and macronutrient pair. So let's just talk about that really quick. So your macronutrients, your nutrients that provide calories, different than your micronutrients, like your vitamins and minerals. Your macros are carbohydrates, proteins, and fats. And they have different rates of digestion and different impacts on blood sugar, or basically energy, right? Carbohydrates quickly spike blood sugar, or blood glucose is another way to say that. Protein takes longer to digest and absorb, and fat actually takes the longest. So when you're pairing like fat and protein with the carbs at the same time, because the fat and protein slow down your stomach emptying or your gastric emptying, that will slow down the digestion rate of carbohydrates as well. So you won't get that quick spike and drop, and you will get more steady release of glucose over a longer period of time. So it helps prevent like the highs, the spikes in blood sugar, but it also helps to prevent the lows because you're getting that, longevity from that meal or that snack when you've got your macros paired. So do try and, pair your macronutrients, even for snacks, like, put some peanut butter with your apple or on your banana or a string cheese with your apple. And then if you're doing a good job of pairing where you've got carbs, protein, fat at your eating instances, that should get you through a 3 to 5 hour window from a blood sugar and energy sense. And then, depending on the size, right? So if it's a snack, maybe it's more like 3 hours. If it's a substantial meal, maybe it's more like 5 hours. And then think about your day. How, if you broke up your day, let's say in 4 hour increments, how would that look for you starting with a breakfast ideally within an hour of waking, and then spacing that intake over the day every 4-ish hours. That gives you many more opportunities for fiber, for plants, for protein, even protein to be spaced instead of like trying to get all the protein in at dinner. So I'll send you some ideas for well-paired snacks. So think about that with your timing of intake and your macronutrient pairing for this coming week. Other things to think about for this week. What do you want to focus on? I would pick maybe one or two of these goals or these topics as goals. So sleep, outdoor time, supportive community time, movement, maybe some of that deep belly breathing, your timing of eating, how you're eating, the environmental aspects of eating. And then think about your nutrients. Do you need to add some leafy greens? Are you getting colors? Are you getting the full rainbow? We'll talk more about that next week, but all the different colors. Maybe you need some more fish or seafood or plant-based omega-3s. Think about some swaps for your, instead of refined grains, your whole grains, nuts and seeds, and healthy plant oils. Beans and lentils are great sources of fiber, protein, and phytonutrients. Those are a win-win-win. And then your hydration. So I would pick, maybe one or two to focus on, write it down so that it's real, and then put it on a sticky or put it somewhere you'll remember. And then join us next week. So we're going to talk about the psychology of food and mood. We'll talk about prebiotics, probiotics, postbiotics, and psychobiotics next week. Some more specific nutrients of concern, herbs and spices, and other anti-inflammatory ways to increase your anti-inflammatory intake, supporting detox pathways, and movement. So hopefully you all can join us next week. Let me just see if I have any other questions. There's a question about triangle breathing. Is triangle breathing as beneficial as box breathing? I don't know triangle breathing. That's interesting. Box breathing is usually 4 counts. So 4 in, hold, 4 for 4, out for 4, hold for 4. That can be super helpful for slowing things down. The diaphragmatic breathing is especially geared, it's not just about the breath, it's about where is the breath in your body, into that pelvic floor, into the bottom of the abdomen. So you're getting that stretch thing happening, which is a good trigger for shutting off those stress hormones. So look up diaphragmatic breathing specifically. There's a good video from the University of Michigan. And then I'll have to look into triangle breathing. All right, everyone. Thank you so much for joining. Thank you for your input and for your questions. And thank you again to Stilly Valley, who is our sponsor for tonight. Hopefully I will also see your names next week. And for those who couldn't join us, no worries. You'll get the recording and the slides. And then feel free to join next week if you can. All right. Take care. Bye-bye.